Hey guys, Dr. Rebecca Warren here from doctorswarren.com, and I wanted to jump on here and talk about my most frequently asked questions about thyroid medication. I do not prescribe medication in my office. In fact, we help people get well without the need of medication because we don't treat symptoms, we get down to the cause. But I do understand that there's a lot of people that have been on thyroid medication. There's people that need some support as they're trying to heal their body. So people do ask me a lot of questions. I'm very knowledgeable on this for two reasons. Number one, because I have a lot of people that are coming in. I actually work with a nurse practitioner here in Chattanooga who's absolutely amazing at, working with my practice members to help them get off of it or to help them with their dosing, so I don't have to work with that. But the most important reason that I know so much about this is because I am on it for the rest of my life. At 19, my thyroid was cut out because they misdiagnosed and never got down to the cause of my thyroid issues. And so when I tell you in the last 15 years, I have gone through it all. I have looked through the research because it was a matter of life or suffering for me. When I tell you that I myself had to go as a patient into different medical doctors' offices to make sure that I got the right one on my team, I've been through it all, and I've actually tried every single one of these medications that we're going to talk about. But, I wanted to share that with you because the most common reason that this question comes up is because there's people that will be on thyroid medication for years or decades and still not feel well and not understand how can it be that I feel fatigued and I'm not able to lose weight, my hair is falling out, and I'm having all these symptoms, and no matter how much I eat or how little I eat or how much I work out, nothing is changing. And they don't understand either because their medical doctor will say, well, your labs look fine. I did a video on labs about 2 days ago, so make sure you look at that video. But it's really important to understand that for a lot of people, they're not even on the right dose. Before you, start changing and playing with your medication, take this information and talk with your healthcare provider. Find a healthcare provider that's going to hear you out, that's going to work with you and understand that you are the best expert for your body. That I, myself, am not the best expert of your body, no doctor, no practitioner, but you fully understands what's going on inside your body and you know when something's off. So what tends to be the problem in regards to people that are on different thyroid medication is, let's go ahead and say, let's break this up. There's 3 different types of medications right now out on the market that you can be on. There's T4 only, things like Synthroid and levothyroxine and tyrosine. We got T3 only, like Cytomel and lirothyronine. And then we have T4 and T3, which is called natural desiccated thyroid hormone, Armour, NP, and Nature-Throid. A majority of people are on T4 only, and that's actually what I was on for 4 or 5 years when I first had my thyroid removed. And at first, after surgery and radiation, I felt kind of like, okay, this might be working out. But then what I started to notice is that a few years in, I did not feel well. I did not feel like myself. I was having irregular cycles. I was like doing CrossFit, and I was pretty much almost like a vegan, but I wasn't losing weight, and I kind of suffered with anxiety and some memory, and I couldn't understand why I was experiencing those things. And it wasn't until a doctor pretty much explained to me that your body's created to heal, and that every symptom is your body telling you that something's wrong. And so I started doing some research. I am going to let you guys know my favorite website out there for some really great thyroid just kind of support and just understanding what's going on is Stop the Thyroid Madness. I love it because it's a website it's by patients for patients. It's for people that are walking alongside you with the same types of symptoms that you might be having, and she just does an amazing job with that website. But I had discovered that. I started looking through the research, and so I went to my doctor and tried to talk to them about it, and they weren't interested in switching me. So I fired that doctor, and I found someone new. I found someone who was willing to work with me, who's willing to hear me out, who's willing to pull the labs that I needed. And I'm so thankful I did that because that's when I really started to feel completely different. Why don't most people do very well on T4? There is people that do, especially if you've started off on it. The reason why is because your thyroid is making T4, a majority of T4, and T3, as well as T1, T2, and calcitonin. But that's another thing. So when you're taking just a T4, you're fully relying on just conversion. You're just relying on your gut to be healthy and your liver to be healthy, because that's where T4 has to be converted to T3. And let me go ahead and tell you, majority of the people that come in to see me, their gut is not well and their livers are not well because of toxins and everything that they've been exposed to. So when you're fully relying on conversion to be well, people don't get well. They don't feel right. But I'll go ahead and tell you this, your TSH can look normal on T4 and your free T4 can look normal on just T4. But then when people go to look at reverse T3 or free T3, they see that's low because they're not converting right. So that's why I didn't feel well on it. That's why a majority of people don't do well on it, is because of that. The next thing is T3 only. This is for people if they've had a high reverse T3 on their labs, or if they feel like they need kind of like extra support. A lot of doctors would like to kind of add a small dose of this. Now let me go ahead and explain this. T4 has a longer half-life, so you can be on T4 and not really see the effects of it until weeks later. T3 is shorter half-life. So if someone's on T3, if a doctor or a medical doctor puts someone on T3, they're usually on like having to take the dose every 4 hours throughout the day, twice a day or 3 times a day, because that's how long the half-life is. So T3 is just a way to kind of boost your free T3 levels. I will say I was put on free T3 right after my surgery, because right before radiation. So after surgery, I was taking off all meds, so I went severely hypo, and then when I had my radiation, I was put on free T3. And it's because it's a quick way to get those T3 levels up, but it's also really important to pay attention to symptoms of hyperthyroid, like anxiety or getting anxious or racing heart, and you can know you're on too much of that. Also, taking some magnesium protects your heart from that hyper symptoms. But what is the one that my practice members, my coaching clients, that people overall feel really great on? It's T4, T3 combined, okay? I'm gonna be honest with you, that's like Armor, NP, Nature Thread. T4 Synthroid has had a monopoly on thyroid medication for years. And so there's a lot of misconceptions, misinformation about the safety of T4 and T3, and it's because a lot of medical doctors will say, oh, it's because of the T3. Well, no, if you're keeping an eye on your patient and you're tracking them and you're slowly increasing, you shouldn't have any issues as you're paying attention to what your body's doing. NDT, natural desiccated thyroid hormone, has T4, T3, T2, T1, and calcitonin. So not only is it giving you T4 that can be converted, but it's also giving you T3 so that you can utilize it, because T3 is that hormone that's going to attach to your cell receptors for thyroid hormones, for you to feel well, to lose weight, to feel energized. So these are the 3 different ones. This is the one that people feel the most well on because they get extra support. But of course, I always say it's about getting down to the cause. I hate when someone's on a natural desiccated thyroid hormone, because you can feel so well, but I have to teach my practice members what caused the thyroid to be dysfunctional is still there. You need to heal the body. You need to get down to the why. Like if you have Hashimoto's, you need to address your antibody numbers. That's so very important. I'll leave you guys with this. I keep seeing over and over, people are messaging me that they feel great on something, and then their doctor says, no. I had that happen to a practice member that was doing so great, and a nurse practitioner was like, oh, no, you're on too much. Well, heart rate is good, blood pressure is good, they're losing weight, their mind is clear, their body is healing, they actually feel so well. He felt so well, and he was so confused as to why someone in the medical field would tell him he's on too much. Well, it's because of misinformation. It's because there's a lot of medical doctors that don't know the up-to-date research, that don't know how to track you besides just TSH. So I leave you with this. Stand up for yourself. Listen to your body. The way you know you're on the right dose is because you see your body change and you feel well. And if you're starting to have thyroid dysfunction, the answer is never just to cover up symptoms with pills, but it's to get down to the cause. So always get down to the cause. Research shows that 20% of cases that have been on medication can actually completely reverse and not need to be on it. The earlier the better, getting down to the cause, but no matter where you're at in your health journey, advocate for your health. You know how you should feel. You know how you should function. So thank you guys for tuning in. Make sure to share and comment. Let me know if you have any questions. You never know how far-reaching this video can be in impacting someone's life and health. Have a